Hello and Namaste. My name is Suraj Koirala. I'm Technical Advisor at TPO Nepal and Council Member of International Rehabilitation Council for Torture Victims.
MAG fully subscribed to international standard for the care and treatment of torture survivors and their families as we commit to be patient-centered. Under Hippocratic Oath, physicians are duty-bound to ensure the best interest of our patients and strictly observe the principle of do no harm.
As according to the global standards on rehabilitation of torture victims endorsed by General Assembly of IRCT, TPO Nepal is committed to provide direct assistance and support to torture victims, especially to the victims of armed conflict in Nepal, aligning with paragraph 1 in global standard.
Notre centre doit formellement fournir ses efforts pour aider donc tout genre de victimes de torture qui sera donc accueilli aussi dans notre centre. Sur cela, nous allons appuyer nos efforts pour prévenir la torture, nous allons lutter contre l'impunité et nous allons offrir une réparation et une réadaptation globale aux victimes de torture.
Desde el colectivo contra la tortura y la impunidad, damos acompañamiento médico y psicológico a personas que han sufrido violencia política, ya sea tortura, desaparición forzada o desplazamiento. En nuestra labor, a lo largo de estos 17 años, hemos acudido a cárceles y a comunidades. También trabajamos con las familias de las y los sobrevivientes, con niños y niñas que hayan sido afectadas y con toda persona que así nos lo solicite.
We understand their fundamental needs and has been constantly advocating for the access of basic health care, mental health and psychosocial support, legal assistance.
We believe that physicians and other healthcare professionals can play an important role, not only to prevent torture, but also to help the victims and their families to seek justice.
Their meaningful participation in social and communal activities and assurance of basic livelihood through community-based income-generating activities.
Nuestro acompañar es desde el corazón, con el compromiso ético de poner en el centro a las y los sobrevivientes, ir a su lado, respetando la confidencialidad de sus procesos, evitando hacer daño, sin imposiciones y respetando su cultura e ideologías.
The Medical Action Group take this as lifelong commitment by carefully rendering our services through examining, recognizing, recording, and reporting of torture via evidence and right-based approach.
À cet effet, le centre s'engagera à fournir les services de réadaptation ci-après. Nous allons s'engager conformément envers les victimes. Nous allons fournir les services indépendants, donner donc les priorités au développement de la mise en œuvre des structures, des méthodologies et des procédures contre les victimes.
We are pleased to say that TPO Nepal has been providing direct support to more than 200 victims this year working. We have mobilized medical doctors, psychiatrists, and psychosocial counselors, lawyers, and community workers to facilitate for their immediate needs. Importantly, 30 victims identified as most vulnerable were provided livelihood support. They were first identified from our local counselors, then provided training to understand the basics of economic activities and asked to them to analyze themselves to select their business plan. Then we have provided some amount to start the business. It is more than 8 months that we started this intervention, and now we can see some of them are really progressing well. Furthermore, we are working with local governments very closely to support these victims and ensure their sustainable and impactful rehabilitation.
We take our responsibilities as instruments of care. We shoulder the continuum of care of torture victims and their families, from treatment to rehabilitation and reconstitution. We know that we can make a difference both as clinicians and as advocates for public health and human rights.